It's rather a blessing to have friends who can volunteer to serve poor communities in Africa. CACHA Annual Medical Mission is a sign of friendship and a commitment to support and improving the health of rural African communities.
I'm called Sister Mary Proskovia Naseje. I'm the in charge of this center, Boli Health Center, and during this mission, my responsibility it has been supervising. I'm so grateful for the work I've done, especially in this mission, whereby many people have been helped. Those who have lost their sight, they have received the glasses and they are very, very, very happy. And those with complicated conditions, they have got treatment free of charge. Many people have been treated. Those with hernia, they have done herniorrhaphy, and the community is really very, very, very happy about that. It's really difficult and challenging in the community because, as you know, most of them, they don't have money and it is due to poverty. So when they get this complication, when they get these conditions, they stay in the communities, they wait for the Canadian volunteers to help them due to poverty. But there are those who can assist and they come in to get the treatment, but the big challenge is paying the hospital bills. We are so grateful with the Canadian volunteers, the CACHA community, for their support they are giving to us, especially our community.
Sister Mary Proskovia is appealing to the community to get more concerned about education and sensitization of the girl child, saying that the girl child is so vulnerable and at a high risk of contracting HIV/AIDS and early pregnancies. April 2014 Medical Mission has brought together a cross-section of 9 Canadian volunteers, including doctors, nurses, pharmacists, and logistics.
My name is Laura Collenberg. I'm a practitioner from Ottawa, Canada. This is my second time in CACHA Medical Mission. I've spent some time in pharmacy, gynecology, and general medicine. I really noticed a difference this year that I'm much healthier from parasites. Still a bit of typhoid, but it's the season. I can really see that the village health team has made a difference going to Goli.
Saint Yakobo Buzabalya Goli Health Center Kamengo is CACHA's medical mission project area in Uganda. This year, the turn-up is rather moderate compared with the past medical missions, following improved health and behavior change. This implies that the past medical missions have benefited the community. The Canadian volunteers are working hand in hand with Goli Health Center medical officers and Care for Your Life Kamengo volunteers.
My name is Nachiganda Harriet. I am a village health worker and I'm a member of Care for Your Life Kamengo. In this mission, I'm translating for the members of the community who don't understand English and to speak it. So I'm translating for them, and I'm working in Gain with Dr. Pat, Dr. Helen, and Dr. Lola.
I'm Ibrahim Ngobia. I'm a lab personnel. So far, we have tested many patients compared to the usual attending of the patients. So far, we are in 3,000 within this 7th day that we've covered so far. On the side of HIV, the community, they have shown up that they have tried to keep their health, and the negatives are higher compared to the positives.
Patients with severe health problems are referred to Nkozi Hospital and Mulago Hospital, the national main hospital, with more medical equipment.
We are again at Nkozi Hospital. We have just finished a second day of surgery. It's on Thursday before Easter. Today we did 6 surgeries, yesterday 8 surgeries. Today mostly hernia repairs. We removed an extra toe. Someone had 11 toes, so now they have a nice set of 10 toes. Everyone is doing well. You have just spoken with Sister Assumpta, who is the biggest help here, along with Sister Dennis.
Anka is my name. I've been working with Dr. Hadley Mark from Canada with the support of Jimmy. We have done a lot of surgeries here at Nkozi Hospital in support of this team. Really, it's very helpful to the community here, and people are extremely happy. So thank you so much, our friends from Canada.
We have such good service here. It is wonderful, and we enjoy ourselves, and I think the patients are doing well. Thank you.
We have to thank the Canadian volunteers for the work well done, including financial support, services, and all their input.
My name is Ken Edwards, and I'm an emergency physician from Queen's University in Canada. This is my 6th mission and my 5th time participating in it. I was on the first mission, missed one, and I hope to come back again in another year as well. This year is different in that we had a much nicer facility. A lot of work has been done on the Goli Health Center. It was much cleaner, much better facilities. There are a few other changes I've noticed. There's a new medical officer who is very good. Jeffrey is excellent. The population of patients that we see, didn't see a lot of school children because we were here over the holiday and the kids were in school as well on the other days. I think that's a good sign, though, that if we're not seeing a lot of school children, it means they're not sick and having to leave school to come see us. I think, generally speaking, the health of the population here is significantly better than it was when we first came. We're still challenged, or the local health people are challenged by lack of resources, of course. The medications, we can only guess what we're going to need when we come. We often run out. Money runs short. We try to keep supplies up, but there are always going to be people that we can't treat the way we'd like to. Dr. Hardy was here again this year, and he did, I believe it was 37 surgeries, all successful, all very happy patients. We have a number of patients that will need surgery next year, and he will hopefully be here to do that. I think we're also looking at ways that we can help to educate people here. Most of the people that came on this mission were people that had been on the mission before. The 4 doctors were all experienced and had been to Kamengo before. One volunteer was new, but everybody else on the mission had been before, and that shows you how much they really enjoy Kamengo and the people in.
We have to thank Agnes Zabari Boys and Girls Club, the home of Maria Nalongo Nandija Community Center, and Care for Your Life Kamengo, Karioka. United, Care for Your Life Kamengo stands with Canada Africa Community Health Alliance. The project is well positioned to enter what promises to be the most vibrant years with the good leadership of Jimmy Sebulime and a renewed dedication to serve the poor. May the Almighty God reward you abundantly.
glad that Jimmy is here this year. We missed him last year. And we are glad he is here with his wife and his daughter. And we are planning, as you said, to be back here next year. We will do all we can to be here. And I thank you for being a place that we feel that we want to come back to. And this is why we want to come back.
And the village health team. This is my second time in Kamengo, and it is really obvious how the community has prospered under their care. So sister and your nursing team, you make me very, very proud to be a nurse. Webale.
Thank you to your sisters who render by supporting Care for Your Life, our children, by paying school fees and all other facilitations.